red character, red skills.
Beginning in the early 1960s, a major change in North Korea's health sector was to go to the field, or the Cheongsanri method. It is said to have been created by Kim Il-sung in February 1960 in Cheongsanri, Gangye County, with a central guidance group, following a setback to the People's Economic Plan in 1959, including a drop in the total grain harvest. This practice of leaders going down to the production site to discuss, help, learn from, and solve problems with the people was later adopted across many sectors. Medicine was no exception. Hospital directors and chiefs were expected to go deep into the group of doctors and nurses to work with, learn from, and teach them. The Cheongsanri method was also an attempt to unite crowds from all walks of life, gaining support and unifying society, which had been deeply divided by the 1956 anti-sectarian struggle. After the Korean War, North Korean society faced difficulties in social integration due to the treatment of collaborators to UN forces, people with families in South Korea, and prisoners of war. The anti-sectarian struggle, which had been in full swing since 1956, had caused mistrust and conflicts that was also an obstacle to building socialism. The order of going to the field was intended to mix all strata of society and force them to overcome the limitations come from their origins. This was coupled with the Chollima movement, which was in full swing at the time. The Chollima movement is a socialist competition of endeavor movement that was meant to dramatically increase productivity in socialist construction, such as riding the momentum of the Chollima, which is a horse that can run thousands of miles. The Chollima movement is basically described as a movement that arouses the revolutionary enthusiasm, high creativity, and self-sacrificing dedication of the masses. To arouse this popular enthusiasm, its main emphasis was on moral stimulation. For example, the motivation was not material rewards, but rather on the worker's sense of honor and moral conscience. Because of this nature, Chollima movement in the healthcare sector was also a human transformation project to change the intelligentsia into revolutionary working class intelligentsia. Hence, the intelligentsia had to demonstrate through their action that their ideology had been transformed. At the same time, in healthcare, both red character and red skill began to be valued. For the reason, in order to be a good doctor, one had to have revolutionary ideology as well as excellent medical skills. Healthcare also had the practical goal of preventing disease and treating patients better, faster, and more thorough collective effort and technological innovations that were similar to the goals of the production sector. But healthcare also has a distinctive characteristic that sets it apart from other sectors: service to patients. And the result of such character in its unique form became devotion, or the Cheongseong movement, which is still cited as an important key to understanding North Korean medicine.
Devotion Movement 1.
In North Korea, devotion is at the heart of health workers' ethics towards patients. The word devotion is embroidered on the gowns worn by North Korean health workers. In describing the movement, the North Korean authorities say that the communist trait of loving people and being devoted to their patients is highly valued by North Korean health workers who, and I quote, spare no blood, flesh, bone, or even life for the sake of the people's lives and create miracle in prevention and treatment of diseases, such as connecting severed limbs, lifting up the disabled, making the blind see, and making the mute sing. End of quote. The devotion movement of health workers became even more important during the arduous march of hardship. With the international collapse of socialism in the 1990s, the entire North Korean society faced economic hardship, resulting in famine and disease. In the face of poor material conditions, the dedication of healthcare workers to patient care was more frequently reported in the media in North Korea. The devotion movement of North Korean healthcare workers who treat patients with compassion regardless of any circumstances originated in the 1960 Chollima movement in the health sector. The movement began in November 1960 at the Hungnam Fertilizer Factory Hospital Department of Surgery. The story of Bang Ah-soo, who became a symbol of the collectivism and dedication of North Korean healthcare workers during the Chollima era, started like this. On November 13, 1960, a boy named Bang Ah-soo was brought to surgeon named Kang Ah-jong with third-degree burns over 48% of his body. With the medical technology at the time, third-degree burns of that extent was too severe to treat. However, the surgical team participating in the Chollima movement did their best to treat the boy. Sadly, regardless of their great amount of effort, the boy showed no signs of improvement, and the council continued to meet night after night for his treatment. The director, chief and acting head of nursing department, joined in to give him a blood transfusion to prolong his life even a little longer. But the blood transfusion could not provide a cure. And in January 1961, 2 months after hospitalization, 17 students from Hamhung Medical University, who were also participating in the Chollima movement, came to the hospital for a training. Upon seeing the burn victim, the students remembered their surgical lessons and asked the department head, Kang, who transplant their skins to the boy. Upon hearing the request, members of the hospital stepped forward to donate their own skins as well. Kang took pieces of skin from 38 people, including his own, for about 4 centimeters per person, and transplanted them into the boy, who could recover safely and saved his life.
Devotion Movement 2.
For North Korean healthcare workers, devotion, the practice of donating one's own fleshes and bones to a patient, became the embodied virtue and ethic of health workers in communist society. According to Kim Il-sung, these examples were not possible under bourgeois humanitarianism, but could only be found in socialist and communist societies, and could only be carried out by red health workers armed with communist thoughts. The red health workers were the most powerful and brilliant of all communist educators and propagandists of party policies. Even the most stubborn people would be grateful and respectful if they fell ill and were indebted to a doctor. Therefore, if health workers were to treat them with care, propaganda party policy, and enlighten them, they would be able to move the hearts and minds of people. It's like turning stubborn people into most advanced ones, and being passive into becoming active, and eventually binding the people around the party. North Korean people's health, based on free treatment and preventive medicine, was an area where the superiority of the socialist system was clearly demonstrated to North Korean people. In order to build a disease-free socialist paradise, where North Koreans would live healthy and happily in hygienic conditions, the country devoted a significant proportion of its budget to the healthcare sector. It sought to achieve total and complete free healthcare by expanding production of medical facilities, medicines, and medical devices, and also training healthcare workers. It was deemed necessary that health workers mediated the nurturing love between Father Kim Il-sung and Mother Workers' Party, or at least portrayed as such. Health workers who treat patients for money were stigmatized as an obstacle to the party and its policies. The remnants of the capitalist idea in every health worker were to be overcome through ideological struggle and communist education.